We are talking about fertility on today's Plugged Into DFW. Welcome back. I'm Jason Allen. Luckily for many, there are increasingly more and more treatment options that are available out there for couples who are struggling with this. Here to talk with us this morning is Dr. Laura Lawrence with Dallas-Fort Worth Fertility Associates. A lot of people suffer the pain of not getting pregnant for years and years and years, but there are increasingly more steps you can take to try to do something about that, right?
Absolutely.
You said earlier there's easy tests and there's easy options. I know you always say it's easy.
It's easy.
Is it really?
Well, some of them are easier than others. Initially, what we recommend is if you're having trouble getting pregnant, just ask yourself some simple questions. Am I having a period every month? That's a pretty easy test to think about whether or not you're likely having an egg. If you're having an ovulation, just to make it round numbers, between 25 to 35 days, your first day of bleed would be the day that we're talking about. If you have the first day and then the next first day is 25 to 35 days later, the chances that you're ovulating are pretty good. If you're somebody who having a period is like Christmas, it's once a year, twice a year, then that's somebody who probably should come and see me. We can do some testing, and there are some tablet medications, painless, that can help people to have an ovulation where they weren't before.
So it's as easy as keeping track of your own body and what's going on in your life. Do men right away from the beginning, are there tests or things that they need to be aware of as well?
Some men will know from their past history or from their personal story whether or not they're likely to have problems. And some of those men are men who have a history of cancer, a history of radiation, chemotherapy. Those men will know right away often to come see me later on. Their doctors may have told them in childhood to go ahead and make sure that they see a specialist later on to make sure that everything's okay. Other things that are very common are there are low testosterone clinics everywhere these days, and everybody is being asked if they're male, are you tired? Would you like to perform better in the bedroom? And the answer to that is almost certainly yes. I would like to. I'm tired. So for men that have been taking testosterone supplements, that can actually have a very detrimental effect on the sperm. And so men who have had recent fevers, there's a flu epidemic going around. If they've had a recent 103 fever, that's also something that can be detrimental to the sperm. Luckily, sperm regenerates every 3 months, and so at the time, if you're trying to be pregnant right then, it's probably good to know if your sperm count has suffered a drop. But many of those types of things, once you remove the source, once you don't have fever anymore, once you stop taking testosterone, many times we'll see the complete recovery of the count.
A lot of times people are concerned about the risks that come with seeking treatment and seeking help. You see things in media and popular culture about multiple births. You see Octomom out there. Are those realistic concerns as you try to seek help with infertility?
Those are absolutely realistic concerns, and that's why we do recommend consultation with a specialist, because one of our main pushes in this country is to decrease the financial burden, the risk of complications, or even death with multiple births. And so what we recommend is in some of the easier treatments, tablets like clomiphene that many people may have heard of, the risks of multiple births are relatively modest if it's well monitored. And so most sources will quote you, most references will quote you anywhere from 5 to 9% multiples, and the vast majority of those are twins. Where we get into trouble is where we start using injection medications which are a little bit more powerful than clomiphene. And so those medications have bump up to about a 20 to 30% risk of multiples, and your risk of higher order multiples start to creep up to where it used to be 1%, anywhere to like 40%.
But that's the point where the patient starts to weigh the risks and the benefits and how far they're willing to go.
Exactly, and then we discuss options where you can avoid using medications like injections that are completely uncontrolled, and we can combine those injections with something called in vitro fertilization, where we actually actually go in, pull the eggs out, and then we can control how many are put back in.
That's something that's based very much on the individual and who you are and the best path for you, it sounds like.
Exactly.
Okay. All right. Thank you. Dr. Lawrence, appreciate all this. Very fascinating, interesting topic that we don't get to jump into a lot, so this is good to get into it. As we keep going here, it's very important for couples to get genetic testing, even before trying to conceive. We're going to talk a little bit about that, plus the new perks that some companies are offering to lure talented women to their workplaces when we come back.